attendants, prepare for takeoff, please.
Hi everyone, welcome to our Vision podcast. I'm Jose Silva and today I have a special guest, Dr. Fadi Bakal. Dr. Bakal is a plastic surgeon that studied in Europe and worked in multiple countries in Europe and now is working at American Hospital in Dubai. He's very special because he speaks 5 languages, that's correct guys, and also loves to play guitar and play board games. Welcome Fadi Bakal, how are you?
I'm good. How are you?
I'm very good.
Thank you for the nice introduction and the playful introduction. But we're not going to play guitar now. Huh?
Yes, but it will be good as
It
well.
will be
It
good.
will be fun.
In the next episode.
Yes, let's do it then. So thank you very much for coming. I'm very happy to be here with you. I already
Thank you for
watched,
having me.
yes, some episode, and that was very interesting about you. So I would like you to explain to our viewers, to our audience, a bit about yourself, your journey, how you came from Iraq to Europe, then to Dubai. So please.
It's kind of a multinational, right?
Yes.
So born and raised in Baghdad, Iraq, up to the third part of my life. And then I was raised actually back then in Holland, in the Netherlands, where I did all my preliminary school, secondary school, and then went to Belgium because 2 countries wasn't enough. So I went to the third country to study medical school.
Okay.
And from there on, the medical career started as eventually to become a consultant, plastic reconstructive and aesthetic surgeon. After the training, I went again to another country, which was Austria, in the beautiful city Vienna, where I did extra technical skills in the aesthetic part of plastic surgery. So this is, in a nutshell, my journey throughout the countries. And now I'm here in Dubai.
Yeah, why Dubai? And when did you decide to go from Europe to Dubai and why?
Why Dubai? This question is actually very easy to answer because Dubai offers a lot in opportunities, in growth, innovation, and of course, image. Not only that, there's a high demand and year in year actually high demand for medical treatments in Dubai, but also for plastic surgery.
That's right.
So plastic surgery is very, as you know, is very known here in Dubai, but globally actually is gaining a lot of demand. And I think this is a good opportunity and good timing to be here in Dubai.
Yeah, 100%. And you have like a European background as well, because you live there and you study there,
Yeah.
and the standards are very different, right? So what the beauty standards, I mean, so I'm also European, I'm from Portugal, and when I arrive here, the people, especially the girls, the way that they look is very different from my country, for example. So what do you feel working in Europe and working here? What is the difference? What, culturally talking, what kind of difference do you realize? And
Well, every continent and every country has its own view of about what is beauty and what is natural beauty.
yes,
And not to mention also the cultural differences between the countries or within a country, actually. So here you have a melting pot of different countries in one, right?
200 nationalities. in
Exactly.
Dubai.
Yeah, I didn't want to count it, otherwise the podcast would be too long. So anyways, the differences is actually huge in cultural matter between Europe and here locally in Dubai, because it's here all about the beauty. It's all about high standards, high-end luxury. Although in Europe you have also some certain high standards, of course, different lifestyle, yes, but the people, the mindset of people or the patients or clients that I treated was like to be more natural, on the
Yes.
natural side, and not obvious in the first view
Impression.
that in the first impression exactly that they did something.
Yeah, it seems about fashion. For example, in Europe, if you have like a Louis Vuitton T-shirt or a Gucci T-shirt, and if you have the logo here, it's
Yeah.
very cheesy. You
Yeah.
know, it's
Yeah.
not good. But here in the region, if you have like a
Exactly.
brand, a luxury
Yeah.
brand, you should have the logo
Yeah.
to people see. And I think it's a bit the same with the beauty. At
Yes.
least, I think people they don't want to look that they have surgery in Europe, and
Exactly, yeah.
here they look like to have like the big lips, and they
Yeah.
do. But also in Latin America, they do a lot of surgery, especially in Brazil, Colombia.
Yes.
And now this trend is arriving in Portugal. I see, and in Europe in general, I see now more people using more plastic surgery. So, what do you feel? How you feel the market, and how you feel is growing? What's happening now?
Well, a lot is happening, that's for sure. And in the plastic surgery market, every surgery is actually very demanding from the people's point of view, and but also the innovation in technology. You know, it's a fast paced, also like Dubai, the city, it's fast paced and visionary. In plastic surgery, you have artistic views that is highly dynamic. So it's changing every single from time to time. And that in certain treatments, we are evolving. And therefore, also the demand is higher. Why? Because the technology is better, the skills are better, the results are long lasting. The results are also shifting now to more towards natural beauty. You know,
Okay.
so there's a huge changes.
You changing, and how is to be like you? You know, how is to be like an entrepreneur and a plastic surgeon here in Dubai, and all this changing, and how you feel about your personal and professional life?
Well, that's a good question. In Dubai, you need to have a vision. You know, with that vision, you already have the opportunities that Dubai offers you, and the opportunities you can see them as tools to achieve your goal and your vision. And that way, you are actually a mix between a plastic surgeon, which is a doctor,
Yes.
medical doctor, and on the other side, entrepreneur, because you want to achieve good results. You want to achieve these approaches with your patients and with your clients without commercializing it too much, but staying within your authenticity and your consistency.
And who inspire you to be that good person and good professional?
As a plastic surgeon, you mean? Or
As a plastic surgeon, as entrepreneur, and as Fadi Bakal.
well, to start with, as Fadi Bakal, my family, but as an entrepreneur and as plastic surgeon, actually one of my biggest mentors. He's a retired plastic surgeon, and he taught me the first plastic surgical stitch that I did. And back then, I was just a medical student. Uh, Although I had already back in my mind to become actually a plastic surgeon, because the reason, or the only reason to do medical school, was actually to become a surgeon. So that was already determined by me. And this idea grew, and this concept grew about plastic surgeon. And then now I'm talking about like 15, 20 years ago, or to be exact, 21 years ago. And yeah, we stayed friends also. And till this day, I'm even still best friends with him.
Yeah, that's nice.
And he taught me a lot of things also about life, about work-life balance, but also about the internship within plastic surgery. He had his own practice as well.
When you have patients, and I think you have a bit of you born and raised in Iraq, and then you moved to Europe, and now you are living here. So you are a mix of different cultures, right?
Mm.
And
Say multinational.
yes, multinational, correct. And do you, when you approach, your approach is a mix of both, or what is your vision?
My vision about that is actually, I'm glad that I had the opportunity to see different schools, to learn from different schools, and to have known different cultures,
Yeah.
because that gives me uh, a lot of instruments, tools to use during my approach and treatments and surgeries with patients and clients. So, what I mean by that is if there's an issue or a problem to correct or to enhance, at least I have several solutions for that. And that is due to my background in different views and cultures and schools.
Yeah. Um, Emotional intelligence is a thing, and is very, very important
Mm.
as a entrepreneur, as a plastic surgeon, as the connection and relationship that you have your patients and your people that around you. How you manage your emotions while you are working and to make decisions, because you need to make a lot of decisions, and the decisions that you make, because you help people taking their also making their decisions, how you manage your emotions and also your patient's emotions to take the best decisions.
Yeah. Well, in my line of duty, you have to be, of course, professional. So, professionalism is number one when it comes to my approach with my patients. And I respect and trust the boundaries that there are while discussing together, okay, what's the question here that has been asked to me from my patient's view? What can I offer? And what is already done or not done yet in the current situation? But we do this in an informed consent situation, which means actually the patient gets from A to Z the total information from the first consultation actually with me about, okay, what's going on. And I'd like to understand exactly what are the desires, what are the needs of the patient's view, that so that I am with the same ship or boat or whatever you want to say of their thoughts, and of their feelings. And we do this together in a consensus. And at the end of the consultation, we made actually the decision together.
Yeah.
Okay, I can guide, and I will guide, but I will never actually force a treatment if I
course.
see that this person in front of me is not 101% convinced about what can be done.
But specific about emotions, how you manage them? You look like very calm, very on control of your emotions. How you control them, and how to make decisions, how you make decisions, and how you balance your emotions.
I think this starts all when you are already knowing what you're talking about. That's first. And second, you can control the situation by giving this trust to your patient. And when you give this trust to your patient feels comfortable. And I like to go outside my own comfort zone, but I like to give this comfort to the patient so that it's a safe environment. It's a safe haven in the situation that I'm during the consultation or during surgery when the patient is awake, like under local anesthesia. We put some music on the background, so everything is like not feeling you're actually with a doctor or you are doing a procedure. And that way you will create a safe haven where you control the environment. And this is for me very important, to give this trust also to the patient. And this I do actually in a very controlled way and in a very easy way,
Yeah.
down to earth.
Nowadays, we live in an era of social media, fast information. As it's technology is like growing and everything is changing. Also, our perspectives. We live in a global city, we can say, right? We have
Or
access.
village, global
Yes,
village.
yeah, correct. We have access to everything that is happening around. So how this impact your work in these years? Because you started some years ago, right? What the social media was totally different. Do you see that difference, and specific what differences do you see on your patients from like 10 years, 15 years to recently?
A huge difference. A huge difference. When I started with my medical training or even plastic surgery training, we didn't had these AI tools yet. And I remember that was actually in the final part of my plastic surgery training. There was some topics during meetings, conferences, they talked about AI is upcoming and stuff like that. But we didn't know what it was, and we didn't know even what can we do with it. But now it shapes our consultation and simulation, which means during a consultation we can use AI as a tool, but it's only solely a tool to bring the idea or the message from a plastic surgeon view to the patient to give some realistic expectation about the surgical outcome of a procedure. For instance, breast augmentation. Okay, the lady that is there present during consultation, she wants to know, okay, what kind of results or does this fit my body or not? We can use some sizing implants, yes, to put in clothing during the consultation, but it's not the same when you see yourself on a picture already with the outcome.
Yes.
So this is where AI is actually shaping the consultation and simulates the surgical outcome. Yet why I am emphasizing it's just a tool, because you need to also be realistic. It's only a tool which will never give you the 100% the same identical image or the perfection.
Of course. It's just like a reference, a visual reference,
a guideline.
A guideline, yes. But specific, what do you think, for example, from some years now, what people ask you more? So there is like any trend, for example, in my experience, and I don't know about that topic, of course, but when I was like 18, 20, all my friends, girls, they used to increase their breasts, right? But now I see a lot of people like changing their faces, right? Like the lips, the nose, and everything. Even here, all those.
The neck.
Yes. Do you feel like those differences? What you can tell us?
I think the difference is in we are doing it now more in public, or more. It gained more visibility.
Okay.
What I'm trying to say by this is, in the past, and especially for men, comparing to women, it was actually a taboo to say you did some plastic surgical surgery. But nowadays, actually, men are more and more seeking to enhance or to correct or to do something actually in plastic surgery. And still, in women, there's a high demand for plastic surgery. Yet we are more open and to speak about it and to say, okay, sometimes even they are proud to say, okay, I did a facelift and a neck lift or something like that, or I did my breast or something, And is the same actually with men nowadays. More and more demands are coming from male patients. So that's the difference.
And what are the main topics they ask for, like the main requirements they have, what they want to change?
Like most of them, the face,
The
to
face?
enhance the face, to change the face, not to change, but to correct some the aging process in the face.
More the aging.
Yes.
Okay.
Yes. So you remember the era of COVID and
Yes.
the lockdowns.
Of course.
A lot shifted from in-person meetings to digital
Online.
meetings.
Yes.
And now we have this podcast and stuff like that. But during a Zoom meeting, you saw yourself more than you were focused on the meeting, you know. And a lot of patients after lockdowns, I've seen a lot of men and women. They come and they say, actually, I had this meeting yesterday night, but I wasn't focusing on the meeting. I was focusing on myself and the camera, and this mask and this. So everything actually, they started to appreciate their own face, but also to appreciate, they wanted to enhance or to correct things to become younger or to look refreshed.
And what do you think about it? Deeply.
I think it's a good idea to seek back your own identity and to reconnect with yourself, because this is also my motto on my website: be first for yourself. In our daily busy life of activities, work-life balance is not that well balanced, actually, as the name it says. We tend to lose ourselves more and more, and very easy. So it's good to reconnect with yourself. And if you want to change, between brackets, but actually I would say enhance or correct things with yourself, then I think it's a good thing to do and to go to your plastic surgeon.
Yeah, but I also believe, I don't know, this is what I want also your opinion, because of social media and because the filters that people use, they think they want to be like the filter, you know, but the filter is just a filter and will correct, and this is that important. People should get that validation from inside or from the external validation, and for the social media and for what they think about it. And there is we should waste and think so much about it, or you should accept our wrinkles. And what do you think?
Well, filters have a lot of too much perfection.
Mm-hmm.
So I say always, imperfection is perfection,
Yeah.
but within the aesthetic boundaries, which is acceptable, pleasing. And if you focus too much on filters, this is surrealistic, to be honest, and you're never gonna, it's impossible to achieve it even. You know, it's like ironing your shirt, but once you have it put on for 1 second, it's already full with wrinkles and cracks and whatsoever, right? So, but you want it to be ironed,
Yes.
and stay ironed for hours. It's the balance in between, right? So a little bit of wrinkles is good. Like my approach is a holistic approach towards my patients, and what I like to advise them and recommend them, and this is also the way that I want to achieve the surgical outcomes of a certain procedure, is that if they, like for instance, one of your friends, you did a procedure and one of your friends saw you after 1 month or 2 months, and they said, Joe, there is something, but I don't know exactly what, in a positive way. Until you mention, oh, I did this.
Yes.
Ah, yeah, of course, now I see it, you know?
Yeah.
So this is what I most of the time can achieve, and because just a bit, just enough to do the job, not too much and not too little. And if there's a need for touch up, you always can do that. But I don't like to do the copy paste.
Yeah, that's true. And also, I believe that you already have people that they think they need like a plastic surgery, but they need like they have mental health issues, right?
Mm.
They need to, before they do that, because they can do, and it's very validated and it's good to improve and to enhance our like aesthetics. But sometimes do you have any case that you say, so before do that, just go to a therapist or something like that, just discover yourself? Because as you said, sometimes people think that they have a problem, or their self-esteem is on external validation, but the problem is inside. And once they do one, they want to do the second, and they are never satisfied because the problem is not there, is inside. Do you have these cases? Do you feel it on a daily basis?
Yes. Occasionally we have certain cases like this, like you just described, and it's actually very challenging to address the situation. And it's like, it's not really convincing, but it's good to talk about it and to speak with that certain person. It's like, okay, listen, I think the main issue is not this, but it's more this. And then they actually begin to realize, when you do it in a very controlled, safe haven environment, which I always experienced it until now, that, okay, a lot of people, they get this realization during the consultation. Oh yeah, it's true. Okay, it's more is deeper than you think it is, because they also give me this reaction. Oh, but I read it on social media, or I saw it on this, or yeah, but is this true or is it not true? So it's not gonna be a 20-minute consultation. It's gonna be a
therapy,
podcast.
Yeah.
It's very challenging.
And what expectations people have on you as a professional and also as a brand? Because nowadays we need also to be like a personal brand and work on personal brand. What kind of expectations do you feel?
From my point of view, or from the feedback that I got from patients,
I think your
colleagues.
point of view also a mix of what the feedback that you received, right? So
Yeah.
let's go for your point of view. What are the expectations that you feel that people have?
Is that the combining of being a plastic surgeon on one side and the other side being entrepreneur, both, you need to have a vision, or you need to have also the being authentic, and those two are very important to me. And this is the expectation, I think, during the approach that I have. It gets these expectations with the certain people in front of me. So actually, to shorten it, is professionalism and authenticity.
And also, do you feel that people expect that you be handsome?
Maybe.
So now let's talk a bit about travel, okay?
Yes.
Because it's also part of this podcast is to talk about business, marketing, personal
Exactly.
brand, and travel. So can you mention one trip that you did that completely changed your mind, that you think, okay, now I want something different, I see a different perspective?
Argentina trip.
Argentina.
Yes.
And why? Can you tell us?
Yes. that was actually personal trip, but also professional trip. So I lived there for a couple of months, and to do an internship, totally not in the field of plastic surgery, because
Okay.
that back then I was still a medical student.
Okay.
So, and we were with also other students from the same university. and it was more or less like an exchange program, But we worked hard, we traveled hard also,
From
and
South America.
actually Argentina itself, because it's
Okay.
a country, a beautiful country with 4 seasons in one country.
Yeah.
So when you go to the west, you will have a moderate Mediterranean climate. When you go to the south, you will have very cold, icy weather, and so on. So this changed a lot my view about being a doctor, but also more personally. Actually, it opened my mind. It opened my boundaries, and I stepped out of my comfort zone.
Yeah.
And I was, I think, like 23, 24 years old. So
It's a good.
changed.
It's a good.
Yes.
To experience that. Yes. Yes. I have been. I never been in Argentina, but I have been 3 times in Brazil,
Mm.
and it's like in one country, it's like almost one continent. You have everything.
Yes.
Yeah, and they are very, very open mind.
Yes.
And it's good because we can put ourselves out there and we can experience and try different things. And it's when you truly know more about yourself.
Yeah.
Right? Because
Exactly.
you have just focus on your bubble, on your
Yeah.
comfort zone. You are that, but you are much more
Exactly.
than that, right?
Yeah. You don't know it at that time until you.
Try
Experience
until you
it. Yeah.
get out of there.
Yes. Yeah.
And mention the 3 best cities that have more impact on you, that you more like to travel. 3 cities.
Where do you find these questions?
They are bad?
No, they are good. They are too good. The best cities in what? The 3 best cities in what?
In what you like the most, It doesn't matter if it's personal, professional, but has some impact on you that you recommend someone to go.
Vienna,
Vienna,
yes. Amsterdam,
Amsterdam. Yeah, I've been in Amsterdam.
yes. And Dubai.
And Dubai. Yeah, that's correct. The first time that I came here, it was during COVID lockdown, because the lockdown in Europe was a thing,
Yes.
very strict. And then I thought, okay, I went 1 week because here in Dubai, everything was open. Then I stayed 2 weeks. Then I stayed more 3 weeks in this year. And the next year I moved to Dubai.
So thanks to COVID, you're here.
Thanks to COVID, I'm here, 100%.
Yes. Yeah.
Then for you, what is the best city to eat?
Bali.
Bali.
But it's not a city. I know. It's an island.
Yes. But for me as well.
Dampazar. Okay.
Yes. To do business.
To do business, for sure, Dubai.
Yeah, everyone says the same.
Yes.
Dubai, 100%.
Yes. Because there are opportunities, vision, and
Yeah.
there are no
The economy is growing, everything
Yes.
is growing, they have a vision.
And stability and safety.
Yeah, and it's very safe. For romance.
For romance, we are from Europe, so it has to be Paris, no?
Yeah, I would say that as well. Yeah, for sure.
Or Rome.
Rome, yes. And for the most funniest one, where you have more fun.
The funniest one. That's a good one. There's too much. When you travel too much,
It's impossible.
It's impossible to choose from one, because in the cultural differences, in the way cities are built or organized, everyone has its own unique identity.
Yeah, I agree with that as well.
So,
but for example, Brazil, I believe in Latin America is very fun to go, right?
yes,
They have a lot
yes.
of open mind. They are very receptive.
I've been once in Sao Paulo and
São Paulo.
Florianopolis.
Florianopolis.
Yes, it's very nice.
You know that the girls more beautiful, they say they are from in the world. They are from Florianopolis.
Yes,
because they have a mix.
Yeah.
Yeah, between like German, Portuguese, European, and with like indigenous.
Exactly. Yeah.
And they are very very beautiful.
Yeah.
And now to finish, what is your best city to live?
Where we are now.
So thank you very much.
Thank you, Joe.
It was very nice to have you here.
Likewise.
Yes. And guys, thank you so much. I hope you like it and see you on the next episode. Bye bye.
Flight attendants, prepare for takeoff, please.